It's a caring father, and the child you see is a child like just because he doesn't know certain things. And let me tell you, my dear friends, that today's scenario expects you to undergo the same torture that people have been undergoing for the last so many years. And that's why you are supposed to face for MSc. How many are there MS candidates? Let me just know. And DNB and D Ortho. Okay. So for MS there are 3 short cases and 1 long case. Similarly for DNB there are 3 short cases and 1 long. You have to just give a definition. You are not supposed to write 10 number of things for definition. There is something other important thing which is described. We have to give an account of that particular. So you have to describe really. You don't have to give only define or discuss. You are supposed to present different aspects of a problem. Whatever problem has been given now. Supposing there is a problem of say limping child. So you have to discuss a limping child. And that's why this particular terminology is important. Enumerate. When you are told to enumerate, you are supposed to give only listing. You are not supposed to give only definition or only classification or some such thing. Enumerate. Summarize. See, these are different terminologies which you must be acquainted with. And that's why what an examiner asks, is interested in knowing you from the exam theory paper is all this. You are not supposed to beat around the bush. When there is something asked about clinical, symptoms, physical science and investigation, that is what is expected in an exam. Lastly, the treatment, whether you are giving conservative or operative, both, basically you are supposed to give both if you know both of them, and you are supposed to know both of them. See, you are supposed to stand upright in the society also as well as in the exam. You have to be amongst, say, these 4, you are supposed to be the topmost amongst the 4. And that's why there is a curiosity all the time. What is that important which I must write so that I can impress the examiner? So this is curiosity, and that curiosity comes. For the examiner, what we see is whether your writing is legible, what is the size of the font, are there any flow charts, self-explanatory diagrams, and whether you are repeating the same thing again and again. So you are not supposed to repeat the things. And that's why now you see this kind of a handwriting. We don't expect this kind of handwriting, neither we expect this kind of a handwriting, where the examiner doesn't know what is written. We have to take a magnifying glass and see that. And that's why, when we take a magnifying glass, do you have a pointer? When we do use a magnifying glass and see this, then we say that cells, he wants to write something about cells somewhere there. And that's the reason why you should not write this kind of a thing in the exam. And that's why you have to be very cool. And what we expect that if you are cool, then you write it coolly, and then the examiner is happy and cool. Think and visualize, that is very important slide, because what happens is when you learn certain things from your boss, you don't think for yourself, you don't visualize things. What we really want you to know is to visualize, understand the subject, know the concept, and whether you are putting that concept in the exam, that is what is very important. That's why in an exam what we expect is you are like this. Aggressive, very aggressive. You have to catch the prey. Examiner is not your prey. Try to understand. You are his prey. But if you are cool, you done it. This is a very important slide. One has to know the basics, and if you know the basics, then only, and that's why I always go down Joy's teaching, What Joy used to teach is to tell you the basics, and that is why we are all here. We have to understand the basic concept of a subject, And if you have understood the concept, then only we know that yes, he is able to say something. There are people, who are interested in talking about too much of recent every time. If you know the basics, then only you go to the recent, and otherwise, you will get jumbly. In short, basics must be perfect. Approach to a case should be practical. What is expected by an examiner. Any test, now Dr. Babulkar will tell you how to examine a shoulder. So any test, there is some basic concept behind a test. Whether you understood that concept, what we are watching in the exam is that, whether you understood the concept. Discussion is really very important, and you have to give a reasonable discussion, you have to give justification. You must know the examination of a particular region. There are anatomical peculiarities of different regions, so you must know what are the peculiarities of a region. Always remember that freedom of thoughts takes away fear. Your thought process should be absolutely free. And that's why I would say, to have all this, you have to be very well dressed in the exam. What we expect is you are well dressed. You will not put a tie. You will not put a, something which is dazzling. But your apron should be clean, it should be buttoned. You stand upright, erect, be confident, be clear, reasonably audible. मराठीमध्ये कुटकुट न म्हणतात तसं करायचं नाही. Do not get confused. So these are some of the general tips that I would like to give what an examiner wants to know from you and what is looking at. Appearance and approach to a case. And whether you have got an arguing nature. So there are many students who go on arguing. I have read it in Campbell, I have read it recently, I have done that, I have done that. I have seen 50 cases of this particular thing. What are you talking about and things like that. So there are no arguments in the exam. Try to understand, argument is really bad. Your behavior has to be really very gentle. You cannot be rude, Putting a stethoscope on the collar like that when you are doing, you moving around in the wards, don't do that in the exam. Your mobile should be off, off mode, literally, no vibrating mode also. Otherwise, something vibrates in your pocket and you are upset. So, your mobile should be off, absolutely switched off. Because otherwise, what you do is many times you take out the mobile phone and then see who is giving you a call and then switch it off. No, not acceptable. Not acceptable at all. Your communication skill is judged all the time. And every point carries marks. Remember, there are examiners who give marks for your approach, who give marks for your basics, who give marks for your concept, and also clear discussion. What I was talking about is argument and discussion. Argument is bad, discussion is good, because argument, when you are doing an argument or you are arguing with somebody, it is trying to find out who is right. When you are trying to discuss, we are trying to discuss what is right. We are not there to prove who is right in an exam. What is right is important. That's why you have to discuss it well. Examiner also wants to know what is your experience in orthopedic operations. What have you seen? Or you have seen only and never washed up, for surgery and never assisted as a first assistant or so. Whether you have performed that surgery, whether you know the approach, whether you can open a thing confidently. And for every clinical case, whether you can justify your diagnosis, that is what is seen. And that's why written here, argument is bad, discussion is always good. Now, I have specifically written here references. There are so many phone calls to the examiner. Now, there are so many examiners who don't like that phone call business. Somebody says, oh, he is my nephew, somebody says, he is my brother, somebody says, he is my friend's son, and all that. Many examiners have that ego and they say, why he has given me a call? So try to understand the examiner as well, because this is what is expected of you. If the examiner wants that he should be phoned by somebody, jolly well you may, but I would request you not to contact an examiner because it may carry some bad reflection. And also there are examiners who say that whoever gives a phone call, they may fail, and whoever doesn't, he will pass. Because there is no godfather for this particular ex-candidate. There are examiners like that. So what an examiner doesn't like is many times references. So that's why I put it as rare and grave. There are some people who like it, there are some who don't. I already told you about recent advances and basic sciences. Now we come to what is expected out of you in short cases and long cases and things like that. I think I should not overshoot. See, these are the routine cases. Malunited collisis fracture, supracondylar fracture, non-unions, infected and failed implants. So all these short cases are there in the exam depending on the availability and where is the exam. Now, places like government hospitals, you have n number of cases, so any day you get new cases. And there are private institutions at some places. Now I don't know what is the situation in other areas, but there are some institutions where there are no cases. So the candidate gets the same case in the same day as the third person getting the same case. So every third person gets the same case in the exam, and the patient gets bored. The examiner is already tired of seeing that case, and the candidate doesn't know, because most of the times the patient tries to deceive the student. And then try to understand that if you know a particular patient that he has got, say, collisis fracture, don't say straight away collisis fracture. What we don't like is when the examiner asks you, what is your diagnosis, and justify. Then you can say it is fracture of the lower end of radius or whatever. But if you are not asked, then don't just jump onto the diagnosis and say something. You just start with positive findings in the case, and then you may say, because of all these positive findings, I feel this is a case of malunited fracture of the lower end of the radius because of these many factors. Now there are other cases like cubitus varus valgus and things like that. Similarly, there are habitual dislocations of patella. See, these are different cases which you have seen already during your tenure of 3 years. But what is expected is the regional anatomy, whether you know it, the questions coming out of those particular cases, and whether you are able to justify, whether you are able to understand and you are able to express in your words how to examine a case and what is the justification in your diagnosis. There are very important cases of tendon injuries about which you most of the time people are not read, and then that becomes a problem. You are surprised to see sometimes a case of an amputation stump where you must know what is the complication rate and what are the different complications of amputation, Miloni, Aboni, things like that. You must be able to say something about science amputation. Then there are examiners who want to ask you about named amputations in the body. So you should be ready with all such questions. And that's why I would advise you form groups, small groups. Have discussions amongst yourself. One of you would be the exam going student and the others will be your examiners. Try to discuss cases, and that will help you a lot in the exam. You must be aware of the fact that what is a proper tendon examination. I think there may be a lecture on tendon and injuries like that. Different diseases, the pathology, and let me tell you, there are certain things which are known as must-know things. There are certain things may know things, or there are certain things which are nice to know things. There are the things which are must-knows, must be known to you. Like tuberculosis in India, must be known. Like DOT, and things like that. What is the routine anti-tubercular treatment regime? All these things are expected that you are supposed to know it. It's a must know. Osteomyelitis, sequestrum, and things like that. Similarly, synovitis, arthritis, ankylosis, arthrodesis, all these terminologies. See, these are all basic things, and instead of reading something very recent, it is better to clear your doubts from your seniors or your bosses and try to clarify them before exam. There are some examiners who will ask you in the exam definitions of non-union, mal-union, delayed union, things like that. And then if you are unable to say that immediately, they will know that this man doesn't know anything about non-union. He wants to just give you the diagnosis of non-union. So what we are doing as an examiner is watching your expressions, whether you are confident enough, not overconfident. But we are trying to see the confidence on your face. You must be able to demonstrate patellar tap. You must be able to say, how do you find out ASIs? Now, let me tell you, my dear friends, that this particular system of examination is going on for years, and this won't change for the next minimum 5 years. MCI, that is Medical Council of India, is trying to change this particular pattern of exam where they may bring in OSCE or something like that. You know what is OSCE? Don't know OSCE. Structured clinical examination. You don't know that? Anyway, there are multiple stations where you will be made to sit, but don't bother about that because that is not going to come in your next 5 years of exams unless you are confident enough to appear 6th year, from today. Otherwise, you shouldn't bother about OSCE and things like that. Ankylosis, arthrodesis, gait. Now, gait is a very important thing for lower extremity, and what we always ask you in any case of hip or knee or anything, any lower extremity spine case, we'll ask you gait. And for that, you must be able to define gait properly. There is no time to give you all such definitions here, but when we do something clinical, we can discuss all those. There are certain frequently asked questions like Q angle. I hope you know, everybody knows Q angle. But in the exam, I don't know what happens. Suddenly, people get blocked. They don't know how to talk about Q angle. Something like chronic osteomyelitis, points in favor, why this is chronic osteomyelitis, or 3-point bony relationship. Now this particular, and that's why examiner would like to know from you, why do you say implant failure? There are other FAQs like, as I said, define non-union, carrying angle, ankylosis, arthrodesis, fracture healing. Let me tell you, all of you are going to be orthopedic surgeons in the society. As an orthopedic surgeon, you must be in bone graft substitutes. All these points come up when you say something about bone grafting. But remember that there is only one important question all the time, that is why for everything. So if you are able to answer why for that question, you have won the issue. Try to understand. This is always there, why for everything. Now for a knee case, what we expect usually that you should be able to say something about patellar tap. When you are able to do patellar tap, that means there is no flexion deformity that is expected to be known by you. There are some examiners who will ask you what is the minimum fluid required for a good patellar tap, what is the least amount of fluid, what is required, what can give you some other tests, and what are the different tests to know whether there is fluid in the joint. In CTV, I think it will be discussed in detail, but always think about the problems in a particular case before you start any discussion. Another interesting observation about examinations is that when you are asked about how will you treat a case, you always say, I'll open the thing and do something. You'll never say, or you don't say, I'll investigate the case. So always investigate in the form of X-ray or lab or whatever. People jump onto the treatment, open reduction, internal fixation, osteotomy or fusion or something, tendon transfer or something, but you never utter a single word about X-ray, because that is the most important, the basic investigation for an orthopedic surgeon. For osteomyelitis also I said, chronicity, sequestrum, all these things are known to you, but the thing is in the exam it is difficult for you to answer, and that's why you have to have a habit of saying something about something in the exam. And that's why I advise you that in the morning, when you are going to appear for the exam, discuss some topic with your friend in English, so that it will start giving a good sort of articulation in the exam. That is very important. Once the practical is over, your situation is like this. And then you say, oh, everything is done. Now I am through. I have done everything nicely. And now there is no problem. Table Viva is hardly 2 minutes. No, in DNB, there are so many who are appearing for DNB. For DNB, there are 50 marks per table. So try to understand that table Viva is important, equally important, because it acts as a buffer. Now, when you are shown this X-ray, most of the people, you look at this bottle, how has it gone there? You are supposed to discuss something about the hip, and when you are shown this X-ray, most of the bosses train you, that look at the central portion of the film so that you will get the diagnosis. You don't see on this side, you see there, and then you are confused what to say. So table Viva is not that simple, but for that you have to see minimum 100, 200 X-rays before you appear for an exam, which are routinely shown in the exam. Failure to identify may be a problem, that's what I say. Now there are different institutions having different kinds of instrumentation sets. So many times it's a problem even for the external examiner to know which instrument they are. So he asks the expert, what is that instrument? And he knows what is it. And he'll ask you. So you can say confidently, this may be this, but I have never used it, I have never seen it. You can give me other instrument, there is no problem. Always say that in the exam, in front of the exam. Don't bother, because you don't know, don't bother. Don't try to beat around the bush. Similar case is about the bone. Don't show the examiner that you have never seen this bone. First you have to identify the bone. And what you are looking at is at your facial expressions, whether you have seen this bone at all. Nobody will give you scaphoid or lunate or triquetrum or trapezium or trapezoid in the exam, try to understand. But if you are given talus or calcaneum, you are supposed to identify those bones. And then you may be asked about classification of fractures, but always remember that when you are given a bone, the examiner is not interested in knowing the attachments of different muscles all the time. So don't go to the library, see Gray's Anatomy and muck that up and cram that everything, at night. That attachment either se nikalta hai. No. We don't want that. What we usually want is an orthopedic importance of that bone in the body. Suppose you are given fibula, and I ask you what is the importance of fibula in orthopedics. You should be able to say that yes, it is used for bone grafting. You should know that at least. You should know that the lower portion of the fibula is important. You cannot excise that. But if I ask you that if there is a tumor of the lower end of the fibula, will you excise it? Maybe you say, yeah, I'll remove that. No, you are not supposed to. You have to do something. You have to see the case and do it. What is the other importance? Supposing I ask you about the ileum. Ileum crest is used for bone graft, alright, but anything else? Now some of the clever students say, yes sir, we use it for bone marrow also aspiration. Good. So you are given extra credit for that. So what we are looking at is your innovativeness or your imagination or visualization of a particular bone in that perspective. Specimen. Now there are some students who go one evening prior to the exam. You have come up to this stage. Most of the students passing their first attempt, right from first standard to 12th standard, thereafter getting good marks, getting into medicine, coming to MS or DNB or DORS or whatever, it's not a joke. Believe in yourself. Try to visualize what is orthopedics, try to understand what is the concept. As I said, I don't want to repeat. Believe in God, is there for your sincere hard work. Have confidence in yourself. Speak slowly, though not very slowly, but speak slowly. Let the examiner understand what we are talking about. Don't beat around the bush, as I already told you. And learn to say no, as I said. And if you don't know a particular thing, don't say, sir, I don't remember. There's nothing like that, I don't remember, no. Say, no, I don't know, sir. Or maybe I have read it, about 5 years back or 4 years back or 3 years back, whatever. I have forgotten the facts, maybe. If you are asked about what is the percentage of failure of this particular replacement in the world, you say, I don't know, sir. Nobody is going to fail you on that. But as I say, I repeat it, the must-know things must be known. Now, in a perfect world, be flexible. I show you again. In a perfect world, try to be flexible. Even in the exam, you have to be flexible. Don't say that there are 4 examiners with teeth like that, and you are Bola or this sparrow there. The examiners are going to eat you. No, they are not there to eat you or be satisfied with that. Try to understand these facts, that if you are cool, examiners are cool. If you give the answers coolly, we are happy and we are not there to fail. So honesty in purpose, sincerity in efforts and hard work, that is the crux. And that's why all the best, my dear friends, and see you as MS